On behalf of the Patient Safety Authority, I'd like to welcome you to this webinar titled Successfully Surviving a Cyber Attack. My name is Chris Mamrell, and I'll be your moderator for this program. Now, I'd like to introduce our speakers for today's webinar. Our speaker is Rick Kondravi, the Pennsylvania Patient Safety Authority's Patient Safety Liaison for the Northwest region of the state. In his role as a Patient Safety Liaison, Rick is responsible for assisting the 85 licensed facilities in his region to reduce and eliminate medical errors. Speaking second is Jason McLean, an associate in the Pittsburgh law offices of Cipriani and Werner, where he concentrates his practice in cybersecurity and data protection and commercial litigation. Mr. McLean works with clients to develop data protection plans, conduct risk assessments, ensure regulatory compliance, and initiate mitigation strategies in the event of a data breach. Rounding out the presentation team today is Norm Mitri, President and CEO of the Heritage Valley Health System. Mr. Mitri is in his 23rd year with the Heritage Valley Health System, where he has served as the CEO for the past 17 years, and prior to that, the CFO for 6 years. Norm's expertise revolves around finance, information technology, strategic planning, and turnaround management. Rick, I would now like to turn the presentation over to you.
Thanks, Chris. So, our objectives for today are to discuss 10 proactive cybersecurity tips, assess the regulatory, legal, and risk management ramifications of a breach, and to review how to address a cyber attack through the review of an actual cyber attack experienced by the Heritage Valley Health System and the lessons learned. ECRI Institute, one of the nation's leading patient safety and medical technology research organizations, places health technology cybersecurity at the top of its 2019 Top 10 Health Technology Hazards. According to David Jameson, Executive Director of ECRI's Health Devices Program, the consequences of a cyber attack can be widespread and severe, making this a priority concern for all organizations. So, to start today's discussion, I thought I would provide a brief overview of the Department of Health and Human Services top 10 tips for cybersecurity in healthcare. On slides 5 and 6, I have a listing of the top 10 tips, and rather than read the list, I thought I could proceed to a brief discussion of each of the tips. On slide 5, you have tips 1 through 5, and on slide 6, you have tips 6 through 10. So, starting with tip number 1, establish a security culture. Security professionals are unanimous. The weakest link in any computer system is the user. One of the most challenging aspects of instilling a security focus among users is overcoming the perception that it can't happen to me. People, regardless of their level of education or IT sophistication, are alike in believing that they will never succumb to sloppy practices. Checklists can help avoid some of the errors due to overconfidence, but checklists alone are not enough. What is needed is a culture of security where every person in the organization must subscribe to a shared vision of information security so that habits and practice are automatic. In order to establish this culture, education must be frequent and ongoing. Management must lead by example and refrain from exceptionalism. And taking responsibility must be among the organization's core values. Tip number 2, protect mobile devices. Mobile devices such as laptops and smartphones have opened a world of opportunity, but they also pose a threat because they are easy to lose and vulnerable to theft and are more easily corrupted by electromagnetic interference, which can corrupt the information stored on the device. Mobile devices are often used in places where the information can be viewed, and not all devices are equipped with strong authentication or access controls. Because laptops and handheld devices are often used to transmit and receive data wirelessly, this wireless communication can be susceptible to eavesdropping, and it is recommended that the data be encrypted. Tip number three, maintain good computer habits. Most medical practitioners are familiar with the importance of healthy habits to maintain good health and to reduce the risk of infection and disease. And the same holds true for the IT systems. New computers and software packages are delivered with an array of options, and it's difficult to know what options to include, but some general recommendations are uninstall non-essential software. Do not automatically accept default and standard configurations. Find out whether your electronic health record vendor maintains an open connection to the installed software, commonly referred to as a backdoor, in order to provide updates and support. If so, ensure that there is a secure connection at the firewall and request that this access be disabled when not in use. Disable remote file sharing and remote printing to eliminate accidental sharing or printing of files to unauthorized locations. Disable access to the account of former employees before the notice of termination is served. And last, data files need to be cleaned off the computer and copiers before disposal. Tip number 4, use a firewall. When antivirus software, while antivirus software will help find malicious software that has already entered, a firewall can prevent intrusion from occurring in the first place. Configuring a firewall can be technically complicated, and hardware firewalls should be configured by trained technical personnel. Because of the complexity of this issue, I have included in the webinar documents that were emailed to all the respondents, webinar participants, a firewall checklist to simplify this review, along with some other checklists pertaining to the other tips that we'll be discussing as part of this presentation. Tip number 5, install and maintain antivirus software. The primary way that attackers compromise computers is through viruses that exploit vulnerabilities. Even a computer that has the latest security updates to its operating system and applications may be at risk. Therefore, it is important to use a standard product that provides continuous updated protection. How can users recognize a computer virus? Some of the typical symptoms are the system will not respond or start normally, such as in the case of the blue screen of death, which we'll hear about a little bit later on during Norm's presentation. The system repeatedly crashes, or the internet browser goes to unwanted sites. Antivirus software does not appear to be working, or unwanted advertisements pop up on the screen, and the user cannot control the mouse. Tip number 6, plan on the unexpected. There are 2 key components to this plan: creating backups and developing a recovery plan. Remember that backup data should not be stored in the same locale, that the plan should be tested regularly, and that cloud computing is a viable option because it involves no hardware investment or little technical expertise. Recovering plans must be done so that when an emergency occurs, there is a clear procedure in place to efficiently and quickly address the issue. Tip number 7, control access to protected health information. To minimize the risk of a breach, you need to establish an access control system that includes username and password credentials and setting permissions. Additional access controls may be configured to include role-based access control. Under certain circumstances, such as an incident or a breach that has to be reported to HHS, having good access controls and knowledge of who has viewed or used the information can help detect these data breaches. Tip number 8, use strong passwords and change them regularly. Passwords are the first line of defense in preventing unauthorized access to any computer, and strong passwords are the ones that are not easily guessed. I know that we all complain about it, but passwords should be changed regularly. Some examples of strong password characteristics are at least 8 characters in length, the theory being the longer the better, a combination of upper and lower case, and 1 special character. Tip number 9, limit network access. Since electronic health information flowing over wireless networks must be protected, it is important to secure the wireless signal so that only those who are permitted to access the information can pick up the signal. So wireless routers must be set up to operate in the encrypted mode. Only and in a good policy, it is important to prohibit staff from installing software without prior approval. Last, tip number 10, control physical access. Not only must assets like files and information be secured, the device themselves must be up to the electronic health record system, must also be safe from unauthorized access. The single most common way that the electronic health information is compromised is through loss of devices, whether accidentally or through theft. Securing devices physically should include policies limiting physical access, such as securing machines in locked rooms and managing physical keys. Now I'd like to turn the review over to Jason, where he will actually review the regulatory and legal risk management concerns associated with a cyber attack. Jason, I think you now are able to advance the slides.
Yep, thank you very much, Rick. Appreciate that. And we heard some good tips from Rick on what to do and how to prevent it. And I'm going to talk a little bit about some of the problems and complications and obligations that may come your way if, despite those kinds of efforts, you still suffer a breach or a security incident. So it helps, I think, to start by defining what is a breach. And the term breach is, it's now a term of art, and calling something a breach versus a security incident carries with it certain legal and regulatory obligations. So when myself or any of the other attorneys at my firm are handling a data breach with a client, we're always careful to call it a security incident before we call it a breach, before we do the investigation that we need to do and gather the information before we can make the determination that, yes, this is indeed a breach. So what is a breach? Unauthorized access, use, acquisition, or disclosure of information. Well, what information are we talking about? It's generally personally identifiable information, so the things that you would most commonly think about: social security number, driver's license number, bank account, financial account information, credit card information, and of course, protected health information. And hospitals and healthcare entities have troves of this kind of data, which is why that they are such a high prize target for attackers. And different state laws and different federal regulations define breach slightly differently. Most of them capture this kind of information under HIPAA, as I'm sure most or all of you are aware. Unauthorized access is enough to trigger a breach under HIPAA. That's not true with respect to some state laws. They require a reasonable risk of identity theft or some other harm to the individual before it becomes a breach. So that assessment can come into play once you determine the universe of which laws are applicable to your particular situation. And just quickly, why bring in counsel? I mean, I get this question frequently. I will be the first to admit that I don't have a technical background, and a lot of times I get asked, why isn't this it's cybersecurity, doesn't that mean we need a bunch of technical people? Well, as I kind of alluded to, you've got a very complex web now of state and federal laws and regulations that could potentially apply, and having to sort through which of those apply and which obligations you have to comply with, and what the timelines are for that compliance can get pretty complicated pretty quickly. Of course, the attorney-client privilege is a big benefit to having counsel involved and letting counsel sort of quarterback the breach response and retain any experts that are necessary. And then myself and the other lawyers at Cipriani and Werner are well experienced in litigation. So when we go into a breach response situation, we're always thinking about helping the client to take actions that build a narrative that can ultimately be used in defense of any potential litigation that may come out, or government investigation for that matter. So this next slide just captures sort of the general considerations of that go into play when there is a breach, gathering information about not only what the nature of the threat is or how it may have entered the system, but also to gather information on what data is at issue and what type of data, how much there is, how many individuals or patients may be involved, so that we can get our minds around what the true scope of the breach is and better define the legal and regulatory obligations. And then in addition to and in connection with that investigation, we're always coordinating with experts, whether that's forensic IT or PR. There's notification providers that will help get the notification letters out to the affected patients. And so we take on the responsibility of coordinating with all of those experts. So to kind of revisit this question of defining a breach and why does that matter, there is a web, as I said, of laws and different regulations that we'll talk about. So starting with the state laws, as of this year, all 50 states, including D.C., and I should also add Guam, Puerto Rico, and the Virgin Islands, all now have their own data breach notification laws. And what those laws require is, at the very least, once you've defined a breach that's occurred under that law, is notification to the affected individuals. Some of the state laws require notice to Attorney General or the three major credit reporting agencies. The important thing to note about these laws is that they apply based on the current residency of the individual or the patient that has been affected by the security incident. So if you have 100 people whose data is affected by a particular security incident, even if you are a locally operated business and don't have any offices outside the state of Maryland, for instance, you cannot assume that only the Maryland law would apply. You have to make a determination about where those individuals live, and I will just say that I have yet to handle a breach that involves only one state. There is always, at least in my experience, data of patients, customers, employees, former employees, retirees, where their data is involved in a breach and they no longer live in that particular state. They've retired, they've moved south, they've relocated, whatever it might be, and where those individuals live currently matters for purposes of figuring out which of the state laws apply. And that can become important because there are differences in each of the state laws. While they all basically accomplish the same goals, they do have slight differences. Some of them require notice be provided within 45 days of discovery of the breach. Others don't have a specific time limit. Some have slight variations on the difference in personally identifiable information. Some states permit a private right of action, meaning that a patient or an individual whose information is exposed during a breach may be able to bring a lawsuit against the company. Some have specific requirements for notice content, and maybe most importantly is that some states have an exception in their notification laws for compliance with HIPAA. So if you are otherwise notifying everybody you should notify pursuant to HIPAA, then you are deemed to be in compliance with that particular state law, and you don't have to specifically comply with all of their provisions. Some states have that, some don't. I would say it's maybe 50-50 on states that have a provision like that and states that don't. And if you have states that do not have that kind of provision, then you are required to not only comply with HIPAA, but also comply with the particulars of that state law. And so assessing all of those obligations and building that matrix, if you will, of this requirement in this state and this requirement under federal law can get fairly complicated. So obviously HIPAA comes into play when you've got patient information or health records that are breached or that are involved in a breach. For breaches that involve more than 500 individuals, notice is required to be given to OCR within 60 days of discovery of the breach. If you have an incident that is less than 500 individuals, then you still have to provide notice to OCR, but only on an annual basis. I can tell you that OCR will, in some way, shape, or form, investigate all or nearly all of the breaches that involve more than 500 individuals. So if you have a breach like that, you are required to notify them, and then you can expect some follow-up phone calls or a visit from OCR to inquire further into the breach. The next slide is about PCI compliance. This is, again, just to mention for any entities that accept credit card payments. If there is a breach of credit card information, you have to notify the credit card companies, and they can conduct their own investigation and assessment of the situation. So that's just yet another thing that you may have to deal with in addition to the state and federal regulations. And as I mentioned up front, we are always concerned about what the post-breach issues are going to look like. So the primary concern when we're called is to make sure, obviously, that the threat is quarantined and we get the right technical experts in to assess the situation and protect the system. And you know, if we can reboot the system from backup or avoid the threat somehow, obviously that's priority number one, particularly for hospitals and healthcare entities, to make sure that downtime is as close to zero as possible. But once we get through sort of that initial phase, the post-breach issues predominate our thinking as we're going through and assessing these regulations, because our role, once we get through that initial recovery period, is to ensure that all the obligations are complied with and that the client's well positioned in the event that there is some kind of post-breach issue. And that can include employee litigation, litigation by clients or patients. And as I mentioned, some of those states have private right of actions, and so they allow for individuals to bring lawsuits when their information is the subject of a breach. D&O litigation is another way. So directors and officers of entities are starting to be pulled into some of these lawsuits. The basis of the claim being that you should have done more, you should have known about some of these risks, and you didn't make the right decisions to protect your patient or your customer or your employee information. Of course, government investigation, and that's not only from OCR, but also from attorneys general as well. There are some states that are starting to become a little more aggressive in investigating certain breaches, and so that's a trend I think that we may see develop. And then, as I mentioned, PCI investigation, and then just for good measure, we throw in potential breach of contract, meaning that if you have any third-party contracts with individuals and you have significant downtime to your system, are you at risk of being in breach of any contracts with any third parties? Are you required to notify any of those third parties about a security incident? Do those contracts or business associates agreements or anything like that say anything about whether you have to notify your contractual parties when you've suffered a security incident? So the somewhat natural follow-up question is, can it be prevented? Yes, there are things you can do to prevent this. This is not a foregone conclusion necessarily that everyone's going to suffer a massive breach. Probably the most important thing is to develop an incident response plan, and at the very least have the first 5, 6, or 7 steps that you can take in the first minutes or hours after you discover a breach, who to call, and what kind of basic steps you can take to help quarantine the threat and preserve information for any kind of forensic analysis. And then we have partnerships with lots of IT companies that will come in and do penetration tests, network monitoring, assessments of networks, because of course this is as much a cybersecurity problem as it is a policies, procedure, and people problem. So we want to attack it from all angles. Consideration of cyber insurance, and then just coordinating with all of those different experts for a pre-breach assessment so that you can consider the consequences of a breach and how you might protect against and respond to one at a time when you're not under the stress of having to respond to it. There's an enormous benefit there. These last couple of slides are just follow-ups on the risk assessment questions, different things to consider. Maybe the most important question to consider in an assessment is how much data you have, what kind of data you have, and where and how it is stored. If you have data that is separated on your network or stored in different servers, just that simple fact might limit your exposure if there's a breach. If you have all of your data stored on one network with no segregation and it's all on one server, if that server is breached, then all of that data is potentially at risk. So giving that some consideration and at least understanding what you have and where you have it is a major benefit when you get into a breach response situation. And then the last slide here on risk management is just some other considerations that we have gone through with clients, either when they're developing an incident response plan or just have general questions about things they can think about to better be prepared to protect against a breach and respond to one in the event that it happens. So I'll leave you with this last thought. I think the best response to a breach is one that begins before the breach ever occurs, and I think you can't talk about prevention and response of breach too much, and so having sort of constant training and discussion about what you can do and how you can improve your security is only going to better position you to hopefully avoid these attacks altogether. But if you have one, it's going to take your downtime or the effect of that breach from maybe weeks and shrink it down to days. And that's obviously the end goal for all of us. So I think with that, I'm going to turn it over to Norm.
Well, thank you, Jason. And I do want to compliment both Rick and Jason on the content of their presentations. And I will tell you all on the WebEx that if you do all of that, you will not experience what Heritage Valley experienced a while ago. So while we've gone through some things that we should be doing, I am going to go over here for you what occurred at Heritage Valley Health System and how we responded to it and the lessons learned. So the slide you should be seeing, the objective of this part of the session is to talk about the surprise of Tuesday morning, June 27th at 7:28 a.m., the actual attack, the response, how we invoked the emergency disaster response team and incident response team plan, what we've learned, and clearly you don't know what you don't know until it happens to your organization, and what processes we've changed since the cyber attack. So for some reason, that slide, let me try it again. So as I was working in my office on June 27th, this is the picture I received. For some reason, that jumped 2 slides. So sort of picture this. It's June 27th, 2017, 2 days prior to the board budget meeting. You can imagine all the work going on within the organization, final preparations for one of the largest board meetings of the year. And clearly at 7:28, this is what came across my computer at 7:28 in the morning. So I happened to be at our Beaver facility that morning, and I had the ability to walk down the hall. And the help desk office is right down the hall from my office. So I go walking in there, and they were unaware we had an issue. For some reason, I sort of got hit relatively first, and all their monitors up on the wall that had information on it turned to black. And then shortly after turning to black, here is the first message that appeared. Imagine reading, oops, your important files are encrypted. And I won't read all that to you other than to tell you that as you read through that on your own, it's pretty overwhelming to read some of that and for the first time in your life see something that says send $300 worth of Bitcoin to the following address. So, of course, what is Bitcoin? And until June 27th, I did not know what Bitcoin was. But just for the record, if I translate that $300 worth of Bitcoin into dollars for you, it was $960,000. And so they wanted $960,000, as you read there, to provide us the key to get our data unencrypted and get it back. And needless to say, we did not do that. These are just some copies of screens that appeared on other computers throughout our experience that morning. So various computers had different messages on it as we started through this process. So the first thing we did is we wanted to research the issue. So think about having to figure out what has just happened system-wide. So real quickly, we convened a senior management conference call, of course, utilizing text messages to reach all the participants, because as you can imagine, we had no access whatsoever. We tried to analyze what was working and what wasn't. And if you're familiar at all with Apollo 13 or the movie, where it's Houston, we have a problem, it was clearly Heritage Valley, we have a problem. So at 9:30 a.m., approximately 2 hours after we were impacted, we enacted the disaster command centers across both hospital campuses. And we have a very robust incident response program and team, which served us well. I'll share with you in a moment. But what we really were able to understand really quickly, that we had no email, we had no hospital electronic health records, we had no ambulatory electronic health records, we had no network availability, we had no management board dashboards, we had no IT communications with anyone inside or outside the organization. So what does that sort of mean to Heritage Valley Health System? Imagine having 3,500 workstations and 1,000 servers impacted by this event. So those are our numbers that we were impacted by on that morning. Very, very overwhelming. So needless to say, we invoked a complete IT shutdown for IT security reasons. We initiated an all-inclusive IT systems evaluation to really attempt to determine where this came from, what it was all about, and where did the attack originate. And so we were trying to research other organizations when we could get some access, and we had to do all that on the outside. So what we ended up doing is we had to establish communication methods via cell phones, texting, and personal emails. This is one of your first takeaways. We all depend on email so significantly that you need to have backup communication methods with people's cell phone numbers and people's personal email accounts. Now, we were very fortunate that for a number of years, Heritage Valley has prepared a little pocket card that has every board member and senior management's personal email account, cell phone number, business phone, and home phone on. So we were able to contact the board of directors immediately via that method. Of course, we contacted the Department of Health by phone, medical staff leadership, where we had those numbers, of course, cyber insurance carrier, all the departments that you heard Jason speak of. And then we established a communication center to the best of our ability at that time, really focused, if you will, on a phone system. The disaster command center was completely operational by 10:15. So if you think about 7:30 in the morning, 9:30 making the decision, 10:15 being operational. What was clear as we started through this analysis And we started this pretty quickly by contacting, of course, both our outside cyber insurance company and an outside IT organization that we engaged immediately to start on the analysis of what actually occurred to Heritage Valley Health System. So a summary of that is Heritage Valley Health System was not the target. We clearly learned that this was, believe it or not, from Russia to the Ukraine. Ukraine was the target. One of our software vendors is who got hit, and I'll talk about that in a moment. Most important, and you heard Jason speak about this, we had no evidence of exfiltration of any Heritage Valley proprietary data, personal health information, PHI, or personal identification. Nothing left our system. What we were hit with was a non-PETA malware. It was introduced through a VPN connection. And just for the record, at the time, we had 1,200 VPN connections connected to our network. This was introduced from Russia through the Ukraine to an organization called Nuance that most of you probably are aware of, and that spread through the Heritage Valley network at that time. So once we assessed the malware and that first Nuance server got hit, it then moved to a second Nuance server. On the second Nuance server, this malware was able to access our Heritage Valley domain administrative credentials that unfortunately included a password, a practice that, of course, no longer exists at Heritage Valley Health System. And it was that there was a software product called WDigest that was enabled on the server that the malware was able to access the credentials and the password. So what is WDigest? What does it allow us to do? It allows the in-memory storage of the plain text, if you will, Windows paraphrases or passwords. So it is the non-PETA malware that allowed this to spread. The administrative credentials was able to hit each server and keep on going right through the network and hit every one pretty much of those 1,000 servers that I spoke of before. So through this analysis, we came up with many findings, but there are three significant findings that allowed this to happen. We had broad VPN access allowing the initial entry. This WDigest was enabled, allowing the password to really get the master key. But most important to us and a learning for us is that Heritage Valley historically had what was referred to as a flat network. It was not a segmented network. So that was one of the other real significant learnings from this experience that we had at Heritage Valley. So as we go through some of the real lessons learned at Heritage Valley, that historically, if you know anything about us, we're very physician friendly. We, for about 20 years, has had our own information technology development shop. We focused on development. We did not focus on security at the level we needed to. We were out of balance. Our portfolio of IT expertise was very aggressive on development, something very similar to, if you will, the stock market, if a financial portfolio. We did not have enough fixed income, or if you will, IT security to really balance that. I must tell you now, we are much more balanced. IT security is now a priority at Heritage Valley. Our IT backups are much more regularly performed than they were before. We did not have multi-factor authentication. At the time, it was on the plan for implementation, but kept sort of just getting pushed down on the plan, and it never made it, if you will, to the top of the list of having that implemented. The other thing that I will tell you that was a personal hit for me, and if you all do this, I would urge you not to do it, I had a habit of saving a lot of my material, a lot of my data on my desktop. I was not backing up my desktop, so I lost some significant files forever because I was on the system at the time that the virus hit. My machine, excuse my terms, got fried. So if you weren't on the network at the time of the virus hitting or the malware hitting, information technology had the opportunity to rebuild your system without losing anything off your machine. I was not so fortunate. I was on my machine when it hit, therefore I lost everything on my machine. Now what we do is all software patches are applied in a much more timely fashion. I'd urge you that if you're not doing it timely as they come out, I urge you to do that. Our physicians had to get used to that there's a time where machines will be taken and updated, if you will. So we are more protected on a workstation basis. We have eliminated or in the process of eliminating the flat network. It's not easy to eliminate it. It takes a lot of time. It's very costly. I would urge you to have downtime procedures. Our nursing units had great downtime procedures, not so much in some other areas, but our nursing areas were very, very, very well prepared in order to go to a backup procedure. The other thing we learned, at least I learned, that a lot of diagnostic equipment may have an IT component of older Windows operating systems that are in ultrasound machines or digital imaging machines. And that was something that all had to be addressed when we took this total hit from the non-petabyte malware. Organizations need to have a backup communication plan. And I think, as you heard Jason and Rick both say, you have to be prepared for the unexpected. You don't know if this is going to happen to you. So the best thing you can do is be prepared. Some of our process modifications is we have now moved IT security out of information technology. It's a separate department. It actually reports to our risk and corporate compliance division. The IT security department itself has grown from a half an FTE to over 3 FTEs as we sit today. Their budgets have doubled in excess of, it's now over $12 million a year that we allocate for IT, inclusive of IT security. Most important is the board of directors receive a quarterly report pertaining to IT security. Needless to say, they were impacted, affected by this. They were not pleased it occurred. They understood it. They understood that we were not the target. But they also were very, very generous in saying, you need to modify your budget so you have enough people and dollars, if you will, to make us safe. And we now apply our patches in a very timely fashion, and areas that did not have, if you will, downtime procedures now do. So a couple of our successes, I will tell you, is that anytime you're faced with a crisis, it's amazing to watch healthcare professionals rise to the occasion. And we really, really experienced that. I will tell you, patient care stayed number one. We had excellent patient care through the downtime procedures, and we did not experience one untoward patient event through this period of time. I will tell you that when this occurred, the more seasoned, older caregivers who have been around for a long time were very comfortable going back to paper downtime procedures and paper charts. Actually, I think they viewed it positively that they could walk away from the EHR for a short period of time. But as we got it back online, you'll see in a moment, we got it back online very timely because of the willingness of everyone on the team to do what they needed to do. Because we're all healthcare professionals on this call, the enactment of the Disaster Command Center, you all know how that works for disasters. That's what we invoked. And there was just a couple pictures there for you. of some of our priorities. You can just picture a room with these wall charts with every operating IT system that we knew of course, up on the wall, being prioritized of how we were going to address it and get everything back up and running on a timely basis. So what I'm happy to report is the hospital-based systems were completely back online within 36 hours. And while we put the disaster command center on Tuesday morning at about 9:30, at 4 p.m. that same Friday, we were able to come off of that command center and get back to some level of normal operation throughout Heritage Valley Health System.
We're going to begin our question and answer period now. And while we're waiting, I actually had a question for you, Rick, if that's okay. Mm-hmm. You mentioned the 10 cybersecurity tips. Of those 10 tips, is there one that stands out as the most important or more important than the others?
Well, I guess, of course, I'm going to say they all stand out and all important. But if I were to choose one, and only because I saw this sort of weave through this theory and thought, and weaving through both Jason's and Norm's presentation too. If I were asked to choose one, I'd probably choose tip number 6, which is plan for the unexpected. And actually, when I was doing research for this webinar, I came across a quote that's kind of stuck with me throughout the entire prep time, for the webinar, and it basically stated that there are 2 types of organizations in the world, those that have experienced a cyber attack and those that will experience a cyber attack. And what that really did for me was emphasize the fact that you really need to prepare for the unexpected. And as I said, I heard both Jason and Norm mention that throughout their presentations as well. So if I were to pick one, Chris, I'd pick number 6.
Okay, great. Thank you, Rick. Norm, the next question I have is directed to you. Was there one common proactive component of your health systems recovery plan that stood out as a recommended best practice that would have minimized the organizational impact of the cyber attack you described?
It would have been, yes. Clearly, if I look at what really caused the problem, that was not a human element because of what came from the vendor. It was having a flat network. We really should have invested time, energy, best practice of having segmented networks a number of years ago. So that would be the best practice that clearly we're on doing as we sit today.
Okay, thank you. Our next question is actually directed at Jason. We're getting a good mix here. Jason, how can an organization best insulate itself from the threat of litigation from a cyber attack?
I think the best way to do it is again to sort of emphasize the same point is to have that sufficient level of preparation before the breach occurs. Because if we get involved during an incident, there's only so much we can do in terms of positioning the client to take those actions and have that kind of narrative that would be a good defense to any litigation. If you do the proper planning ahead of time and you're making the right decisions and you're giving this its due consideration, that's going to best position you to not only take the actions to effectively respond to the breach, but also position you well to defend any litigation. One sort of illustration of that point is I've periodically done updates on OCR fines and penalties, and the thing that they seem to focus on is not so much, oh, you suffered a breach, how many records was or did it involve, your fine is X. They're focusing on, did you notify timely? Did you make the right considerations when you were responding to the breach? Did you make considerations about your cybersecurity before the breach? Was this a known issue to you that you didn't adequately prepare for? Those are the kinds of things they're looking at, and those are all things that any entity can take care of well in advance of a breach that I think position them well for any kind of defense.
Great, thank you. I have another question here for Norm. You mentioned a little bit that the older nurses were comfortable going back to paper, but were there other generational differences that you saw in the adaptability of the hospital staff, basically to the communication, the documentation issues created by the cyber attack, and then also the aftermath and the corrective actions?
No, not really. I mean, clearly we knew everything that was on paper had to be re-entered or had to be entered in electronic health record. That all happened very expeditiously we're very blessed to have a number of nurses who all actually work in our information technology department and to help us implement. Heritage Valley is on Allscripts SCM, Sunrise Care Manager for the hospitals, and Allscripts TouchWorks for the physician offices. And we have such a number of clinicians that work in the IT department, they were able to help get that information into SCM and TouchWorks as we brought that back up online. So no, we did not have any of those generational differences at all. What's really important is to watch the people pitch in as a team, and I think that's what's so important and what's so special about healthcare. People rally to a crisis, and it was just phenomenal to watch a mix of all these folks work pretty much round the clock, Tuesday through Friday, in order to get us back to where we need to be.
And then Norm and Jason, I didn't know if there was anything else you wanted to add that you maybe weren't able to include in your presentation. I know one thing, Norm, that I was interested in is that I cover the northwest region of Pennsylvania, and there's overlap of facilities, and I didn't know if there were any, and I'm not sure what the right term or phrase is, but affiliated organizations like other community ambulatory surgery centers or physician practices that were also impacted. I'm trying to get a feel for the actual extent of, the actual cyber attack and, how far-reaching it was with regard to not just, your day-to-day operations within the Heritage Valley Health System, but also with some of the other affiliated organizations that Heritage Valley Health System may be dealing with.
Yeah, so in southwestern Pennsylvania, we were the only impacted organizations because we shut all interactions down to other organizations. And in fairness, a lot of outside organizations shut access down to us because they didn't want to run the risk of being impacted. It was a very prudent thing to do. In southern West Virginia, Princeton Community Healthcare System also got hit the same day, same time, same malware, and I believe someone on the West Coast got hit, Rick, with the same malware attack.
And it looks like we don't have any more questions coming in, so would any of our speakers like to add some final comments before we conclude today?
This is Norm, just thanking you all for attending. Thank you very much, and have a focus on IT security. That's my final recommendation to you.
Yeah, this is Jason. Thank you all very much for your attention and for attending. And I also want to compliment Norm and his team on their response to the NotPetya virus, because that was a particularly nasty piece of malware. And from the information that Norm relayed, it sounds like his team did a phenomenal job in responding to that. So kudos to you, Norm, for battling that piece of malware.
A lot of lessons learned through those few days.
Chris, I would like to conclude with thanking both Jason and Norm for sharing their expertise and knowledge about, what they've gained both through research as well as a personal experience with regard to this, and sharing that information on this webinar for the Pennsylvania Patient Safety Authority.
All right, so with that, we will conclude today's webinar. Again, thank you to our three speakers and for all the attendees. Have a nice day.